What about negative pressure wound therapy? The definition of it is pretty simple: application of subatmospheric pressure to a wound in a closed environment. The key thing about this foam is that it's open cell. What that means is that if you suck here and you seal off the rest of it, that suction will convey through the open cells all the way to the other part and all surfaces of that sponge. So if you apply the sponge, it will suck everywhere that it's contacting the wound. It comes with this adhesive drape material and suction tubing and this special pad. It's called a SensaTrack pad. So the technique is super simple. You debride the wound. You take the foam and you use some scissors, sterile scissors, to cut it to the size of the wound. You stick the foam in the wound and then you cover it with this adherent drape. Then once you've got that adhered to the skin, you cut a little hole the size of a quarter, and that's where you're going to apply that SensaTrack disc. You connect the tubing from the SensaTrack disc to the machine, and then you turn it on. And what it does is a couple things. It creates strain so that when you turn it on, the foam will go and get smaller, and that's pulling the edges of the wound closer together, so that it actually starts to stretch the skin so that it will be easier to close the wound surgically later. So that's what they call macro strain. The other thing it's doing in the meantime is that if this is a really effusive wound, it's the ideal kind to use this on. Where you're having to change the bandage twice a day, this is sucking all the fluid out of the wound, and you can leave the bandage on for 3 days without changing it because it's removing the fluid. It's less of an advantage when the wound is relatively dry because you could be changing the bandage every 3 days, with the standard technique. The other thing that it does is it creates microstrain, and they have a cute video that shows that. At a cellular level, it stretches the cells, and that causes them to enlarge and to divide so that they fill the wound quicker. And essentially, it makes granulation tissue form a lot more rapidly than with wet to dries or telfas. They call that microstrain. You turn it on, and you set the pressure by increasing or decreasing here to 125 millimeters of mercury. This one is set on continuous, which means it's suctioning constantly, as opposed to intermittent. Intermittent suction, where it goes on for 5 seconds and then off for 10 seconds, then on for 5 seconds, that has been shown to be even more rapid in producing granulation tissue in experimental models. But with people, they decided not to do that much because the person goes, ow, every time it turns on, and then goes, oh, every time it relaxes, then ow! And if you try that for 3 days, you're not very happy. So although dogs don't do that, we decided that it's probably nicest. They probably are experiencing pain. So it only hurts when it kind of goes on, and then it seems to relax. So the indications of using it, as they described, open wounds are the biggest one for second intention healing. You can use it for delayed primary closure, or you can use it to stimulate granulation tissue and then switch and let it heal by second intention. Contraindications are important. One is that you shouldn't apply this directly to vessels, nerves, organs, and anastomoses. Other things, you're not supposed to put it on tumor resection sites. They're worried that it might increase blood supply, which is good for wound healing, but it's also good for cancer. And it may tend towards metastasis. I don't think it's more of a theoretical thing where they don't want to get sued. You're not supposed to put it on necrotic tissue or eschars. Like I said earlier, you have to do surgical debridement first. And you're not supposed to use it in untreated osteomyelitis. So you can use it on exposed bone, but you're supposed to get rid of the infection first. It also is used in people and in animals, it's been described now, for open abdomen management. So when you have an animal with septic peritonitis and you don't feel you've completely controlled or there's continued inflammation after you've finished treating the primary problem, sometimes you can place a closed suction drain. This is an alternative, and they sell a special membrane that you put over the hole that you leave in the abdomen so that it doesn't suck directly on the intestines or anything like that. It has little holes in it, and that allows you to suck the fluid out of the abdomen after surgery. You leave the incision slightly open, just like old-fashioned open peritoneal drainage, where you loosely put a continuous pattern in the linea alba and then put this adherent or non-adherent permeable pad down, and then the suction. In summary, negative pressure wound therapy is not a substitute for wound debridement, just to echo that again. But it is helpful to manage especially very effusive wounds, wounds with large areas of degloving, or to expedite granulation tissue before you're doing another definitive therapy like a skin graft or primary closure. Usually it's most beneficial in the first week, and then you would take it off.